Hi everyone. So let us discuss the radiology questions that were asked in this year's FMG exam, and I have seen that there is a fair bit of mix, which is slightly unusual that they have asked. The clinical subjects are a little bit more tricky in this paper. So when I talk to many students who have given the exam, so what I've realized is that after this exam, the paper 1 was more based on the PYQs and had shorter stem questions, while paper 2, which is the more clinical paper, had a little bit more trickiness to it. And radiology had, say, good representation in this paper, and that is the way forward even for the next exam. So the proposed next exam for foreign medical graduate should happen by the end of 2023 as per the recent draft guidelines, but it is all subject to the final notification that the government will give. So in the next, it is proposed to have more clinical paper, more clinical subjects, and radiology is a unique subject which has contribution to every subject. Like there is a radiology part of medicine, radiology part of surgery, radiology part of, say, Obs Gyne, pediatrics. So we have radiology everywhere. So this was reflected in this year's FMG paper also, that we had a good number of radiology questions and a good number of integrated questions in radiology. I'll give you an idea based on the questions, and I'll try to discuss each of them separately. Also, I will tell you what was the way in this paper. So National Board, whenever they make a paper and they add radiology questions in the paper, be it NEETPG, be it FMG, they have a structure in the paper. And that structure is, they put questions from each system. Right? Try to imagine and think with me. Suppose you have to make a FMG exam and you want to make radiology questions. You would put some questions on chest X-ray, some questions on brain, some questions on emergencies, some on kidney, some on GIT, one on radiotherapy, so that you have a fair mix of all the subtopics in radiology. So this is how the paper was, created in this year's paper. So let's see the first question. Okay. So first theme that I noticed in radiology question was they had emergency based radiology IBQs. So I will ask you the question and let's see how many of you are able to tell me the answer. So if you have been following me on the DAMS-eMedicoz channel on YouTube, or attending my lectures on the NEETPG app or face to face, this is one statement that I've given in every of my class, that in FMG exam you will always have brain hemorrhage. So I want all of you to look at this patient. This patient had a road traffic accident, and I want all of you to answer. You can see a biconvex hematoma limited by sutures, which is taking a biconvex lenticular shape. This is what happens if you have rupture of the middle meningeal artery in the epidural space. So what is the answer to the question? The answer to the question is extradural hematoma. This was EDH, extradural hematoma. And the question was very clear. The patient had a road traffic accident. The vitals were stable. There was no hypertension in the history. And in hypertensive patients, it is again a possible question for your June exam, that they might give you a putamen hemorrhage and they might ask you intraparenchymal bleed as a question. So it is this. However, in this particular question, this is a clear-cut image of extradural hematoma. Second is a repeat question. You might have seen this question in the multiple times where I've discussed emergencies, including the DVT. I've always told you that if you see a coin on a chest X-ray end on, if you see it rounded full circumference, that means it is in the esophagus. That means it is not in the airway, it is in the esophagus, and esophagoscopy was the answer to this question. So this is a indirect repeat, but this is in the NEETPG question bank also, so it can be asked in the NEETPG also and FMG exam also. This year's FMG exam, the paper 2, it felt a little bit more like NEETPG than the classic FMG exam, while the part 1 was more like FMG paper. So what I have seen is that ultimately these both exams, NEETPG and FMG, have to become a single exam called as next exam. So even the question banks right now also have started to merge. And you can see the feeling of the same in this question, that this is a previous NEETPG question also indirectly, where they had shown a coin and you had to tell where is the coin located. Is it in the trachea or in the esophagus? In trachea, because of the rings in the airway, it has to be end on like this. How you see it, full circle, that means it is in the esophagus. I'm sure many of you got it right. And the third question based on emergency, which is again one of my favorites. I have seen this, if a patient is bedridden and becomes breathless, patient was bedridden, suddenly developed breathless, and the chest X-ray is normal, it points to a diagnosis of pulmonary thromboembolism. Bedridden stasis leads to leg vein thrombosis, which can lead to pulmonary embolism, and chest X-ray in pulmonary embolism is usually normal. Although you can have typical findings on X-ray like Westermarck signs, Hampton's hump, but they are less common. The usual thing is chest X-ray is normal. So what will you do? You will do a CT angiogram. CT angiogram is the investigation of choice for pulmonary thromboembolism. So let's revise. There were 3 questions where I could place the source as emergency, which is a big number considering if you get 150 you pass the paper. 3 radiology questions were image based on emergencies, and you can remember them for next June exam also. Brain hemorrhage. Remember brain hemorrhage, write down in your notebook. Either they will show you putamen hemorrhage, extradural, subdural, subarachnoid. One of them will definitely be there in your paper. Okay. Number 2, foreign body. Foreign body, very important and a very important theme. It has been repeating again and again in the FMGE and NEETPG exam. I want you to remember the second part. And third is thromboembolism, pulmonary embolism. Fourth is aortic dissection. Out of these 4, you definitely will have a paper question in your exam next in the June 2023 FMGE exam also. So it's a very important theme in the FMGE exam. Are you clear? I hope you get it. So I will be very happy if you got these right. They were all discussed in your classes, and this is a very, very important question. Emergency IBQ radiology clinical integrated. Now let's see the second part. Now I told you that they put questions on systems, some on GIT, some on kidney, some on radiotherapy, some on chest X-ray. In urinary tract, I want you to mark my words. You can keep a clip of this video. It will help you in the FMG exam also, next time also. In urinary tract, don't forget these 3-4 things. Number 1 is polycystic kidney, horseshoe kidney, renal tuberculosis, stone. Stone in the urinary tract, TB of the urinary tract, polycystic kidney, horseshoe kidney. Matlab, one of them will definitely be there in your June exam. That is the confidence that I have in the, usual things. So let's see the usual things happening in front of you. This patient came to the OPD with flank pain, hematuria, abdominal CT was shown to you. So this was the CT scan shown to you. On the CT scan, I want you to believe with me and see this is your kidney, the white one, and you can see there is a isthmus connecting it to the kidney on the other side. Anyone in the chat box can tell me what is your diagnosis? Horseshoe kidney. See, the only thing difference that they did in this FMG exam, and I am wanting you to know that this can happen in the NEETPG exam also. Classically, in horseshoe kidney, they have always shown us an IVP image with the kidneys rotated, the lower pole calyx rotated with a flower vase-like appearance. This time they give a appearance which is more on a CT scan, which is the investigation of choice. Investigation of choice for horseshoe kidney is a CECT, and they had shown a horseshoe kidney, and I'm sure most of you were able to identify this, and I'm very happy if you were able to do it. But if somebody is appearing for the FMG exam in the June, mark my words, do not forget to look at these 4 visuals. Stone in the urinary tract, horseshoe kidney, polycystic kidney, putti kidney. Must know. And you can already see that if you know the usual things, you are usually correct. Okay. And I think Avinash was right, Niaz was right. I'm so happy that you were able to answer in the chat box. And just like I predicted, just like I told you, stone is very important. Investigation of choice for urinary tract stone is a NCCT. Gallstone is ultrasound, urinary tract stone is NCCT. And this patient had pain in the side and the back, increased frequency, burning sensation, all pointing towards UTI, urinary tract infection, ureteric colic, and the X-ray was showing us these radio opaque shadows which you can see here. One is here, one is here, one is here. These radio opaque shadows were kind of along the line of the ureter. So what is your diagnosis? The diagnosis was we are looking at ureteric stones. Stone, very important. So in FMG exam, sometimes they show a X-ray showing you gallstones, sometimes they show ultrasound showing you gallstones, sometimes they show you bladder stone, this time they've shown you a ureteric stone on a X-ray. So stone is very important, don't miss out on stone. So urinary tract I already said, stone, TB, polycystic kidney, horseshoe kidney, very important. Very, very important. And it's like, it's the usual thing. But the problem is sometimes they show bladder stones, sometimes they show ureteric stones, sometimes they show renal staghorn calculus. So I want you to be very clear and you should be able to do it. But mark my words, last year in NEETPG exam, they had shown IVP image where there was a distended pelvic calyceal system and no ureter was seen. So because that was not a plain X-ray, that was IVP, that was PUJ obstruction. So don't get confused. Stones should be seen on a plain film, plain CT, plain X-ray. Stone calcification always seen without contrast. Everybody gets it? Okay. Let me ask you another question. So next was slightly integrated. The patient has loss of appetite, constipation, urinary symptoms with stone, psychiatric disorders. All this triad is typical of hyperparathyroidism. And before you operate on a patient with hyperparathyroidism, you need to localize the parathyroid adenoma. To localize the parathyroid adenoma, investigation of choice with technetium sestamib scan. Investigation of choice for parathyroid adenoma is technetium sestamib scan. But if for you are appearing for NEETPG or a INI-CT paper or central exam, keep in mind most accurate for localizing parathyroid adenoma is a 4D CT. Investigation of choice, technetium sestamib scan, multiple times repeated questions. The only thing that I want you to notice is this length of the question. This was the difference between paper 1 and paper 2 in the paper. Paper 1 had more straightforward one-liners. Paper 2 had a little bit longer questions. But don't start looking at USMLE questions. That is not the pattern of FMGE exam. FMGE exam, even if it's a clinical question, it's hardly 3 line or 4 line. It is not very long. Don't get confused by people telling you to, look at all USMLE resource. That will take a lot of your time. That is not the kind of questions that are asked in Indian licensing exam. You have more one-liners. And even if they ask clinical questions, they are more, 2-3 liners, 3-4 liners in the paper. So I hope this gives you the perspective that you need. Okay. And I also want to point out a theme that I've seen in National Board that NBE, although now it is merged with NMC to conduct next in the subsequent years. But NBE, they like to ask questions which are integrated between ENT and radiology. Like I showed you a foreign body in the esophagus in X-ray. Okay, or I've also talked about last year's NEETPG exam. They sometimes they ask you some sinus X-ray like Waters view. Waters view is very important from FMG exam also. This time what they did in FMG exam was they gave a CT scan. This is a non-contrast CT of the paranasal sinuses. This is a coronal section of the paranasal sinuses. Paranasal sinuses are best seen on coronal view. This time they had put up an arrow here in the paper. In the exam there was an arrow here saying identify the structure. What was the structure? It was your maxillary sinus. So the question was identify the marked structure on a NCCT, maxillary sinus. They love asking Waters view. The only difference this time was instead of Waters view they gave a CT scan, and instead of asking what is the investigation, they asked what is the structure marked. And I want you all to remember it is a possible question for your NEETPG also, but a slightly difficult level. They might ask you some other variant, they might ask you concha bullosa, them in INI-CT they have asked you cribriform plate, but the entire idea is anatomy plus radiology integrated. This is a coronal CT scan of the paranasal sinuses, and they had put an arrow at the maxillary sinus. I hope you all got it right, and if you got it right, do let me know in the chat box or in my inbox. I'll be very, very happy. Okay. Another recurring theme in FMG exams in radiology is they keep asking questions with investigation of choice. Now I'll give you some ideas which I think are important. One was they said gold standard for investigation for fistula in ano. So if you remember my classes, I always tell you perianal fistulas today are operated based on their MRI appearance. MRI is the investigation of choice for fistula in ano. The confusing thing was, you can see here, they had said sinogram. So some people got confused with the word sinogram. Sinogram is not the answer. The answer is MRI. For pelvis, we prefer MRI over most of the modalities. So we can see the internal and external sphincters. You can see the relationship of the fistula to the sphincters, and you can decide your surgery based on the MRI findings. Investigation of choice or gold standard for fistula in NO is MRI. We can also say MR fistulogram in a future exam. But that makes it more direct. So they often say X-ray, ultrasound, CT, MRI. MRI is the answer. Okay. I hope this gives you the perspective required, but it is a very, very important potential question. Again, one more investigation of choice was, what is the investigation of choice for neuroendocrine tumors? This question was also asked in an INI CT exam 2 years back, but at that time the question was slightly more deeper. Answer to this question is PET CT, but what do we use in PET scan when we are doing looking for neuroendocrine tumor? We use 68 gallium dotatat PET. 68 gallium dotatat PET is the investigation of choice for neuroendocrine tumor, which is also a potential question for any subsequent exam. Okay. And so I have shown you the themes. So there was some questions on chest X-ray, but they were very, very direct. In one question, they actually went on to, they just put a X-ray here. They marked upper and the lower border of the rib with the green color, like I have marked here. And they asked, what rib is this? So what happens is, when you look at a chest X-ray, the posterior part of the ribs are these are the more horizontal parts, and then we have to track them anteriorly. Like this. So what is happening is, let me use the mouse here to trace. This is the first rib, second rib, third rib, fourth rib. So what we could see, the marking was at the fourth rib posterior part. So you have to see the horizontal, you have to track it like this. Start looking at my cursor here. This is the posterior part. This is the anterior part. So posterior part is more horizontal, anterior part is more vertical. You can see it here. Second rib, third rib, and now I will follow the fourth rib for you. This is the fourth rib where the marking is. Okay. So again, this was like a question that is they've been asked in FMGE exam. They've only asked you to number the ribs. They could have, asked something more meaningful and more deep here, especially when you're looking at a computer-based exam where the images sometimes are small or big. It's not like very simple. Sometimes you have to, really dig your eyes into it to see clearly. But I've asked many students, and most of the students believed that the marking was on the fourth rib posterior part. So I hope you got it right. Second is ground glass appearance in the lung is seen in. So ground glass appearance is seen when you have partial opacification of the alveoli. You see it typically in COVID pneumonia. But unfortunately, COVID was not in the choice. There were two choices which were pleural. Pleural effusion will lead to entire of the thorax appearing opaque. You will see the dense opacity. You will see CP angle blunting. Pneumothorax will be more lucent. Asbestosis is more pleural pathology where you have, say, pleural plaques, pleural calcification. Pleural calcification leads to holly leaf-like appearance. So I don't think that is the answer. The answer is silicosis. And the X-ray that they had shown had some upper lobe involvement, and you always remember silicosis is more upper lobe, asbestosis is more lower lobe, and you could also see there was some lymph node enlargement. So silicosis leads to upper lobe fibrosis with involvement of the hilar lymph nodes. The hilar lymph nodes can have eggshell calcification, which is again a potential question for the June FMG exam. So remember the answer to this question. Out of the choices that I have got is silicosis best, but there are different recalls floating around saying anthracnosis or begosis were also in the choice. But still I think silicosis is what they are looking at if I look at the X-ray and I look at the question. But probably the better question would have been, they could have asked COVID has multifocal peripheral ground glass opacities, which was the more usual thing to ask in the exam. And one of the things that I've noticed is chest X-ray. Notice this very important. Respiratory medicine is often asked more in FMG exam than in other exams. This time in the paper one I saw biochemistry was more easier, pathology was more easier. Clinical subjects were more trickier, they required more understanding, and now maybe once the next is implemented, you will have to focus more and more on the clinical aspects of the basic sciences also. So again a chest X-ray, but this time this is a pediatric X-ray. The child is having frothing from the mouth, difficulty in breathing, and on the X-ray we could see a Ryle's tube coiled in the neck of the baby. So why is the Ryle's tube getting coiled? because the esophagus is not formed beyond it, there is esophageal atresia. But if there is esophageal atresia, then why do we have gas in the stomach? That means there must be some communication with the tracheal bronchial tree. So we are dealing with a case of tracheoesophageal fistula. So the answer to the question was tracheoesophageal fistula. And I'm so happy, Chaya Kapoor, that you got it right. It is a very, very important potential question for your NEET PG also. It has been asked in NEET PG as well. X-ray showing a coiled Ryle's tube in the neck. Think about tracheoesophageal fistula if you see gas in the stomach. Okay. And they always like to put one X-ray of bone tumor. So if you are today listening to me for a June FMGE exam, keep in mind they can ask you simple bone cyst, giant cell tumor or aneurysmal bone cyst. But this time they had asked us this image. So there was a bony outgrowth from the metaphysis of the bone growing away from the joint. So there is a bony outgrowth from the metaphysis growing away from the joint, which is called as exostosis. This is called as exostosis. A popular name for exostosis is osteochondroma. So the answer to the question was osteochondroma. Don't get confused with enchondroma, which was asked last year in NEET PG exam. Enchondromas are benign lesions in the phalanges. And don't forget, they might ask you Maffucci syndrome or Ollier syndrome in enchondromas in your exam in future as well. But here, this was clear-cut osteochondroma or exostosis, a bony outgrowth from the metaphysis growing away from the joint. This is osteo because this is a bony outgrowth, but there is a cartilage cap over it which is called as chondroma. So we say osteochondroma, cartilage cap is not visible on X-ray. You need to do a MRI to see the cartilage cap. And there was a direct question on radiotherapy where they said if you give 1.8 to 2 gray radiation once daily for 5 days for 6 to 8 weeks, this is conventional radiotherapy or conventional fractionation. So if you give more than these fractions, then we say hyperfractionation. If you give less than this, we say hypofractionation. Only thing I want you to remember other than this is hyperfractionated radiotherapy is used in, answer is lung cancer. Hyperfractionated radiotherapy is used in lung cancer. Again, a potential question for your future IN NEET PG or your future FMG exam. So you can see the pattern. They have taken few questions from chest, few from kidney, few from radiotherapy, and then they have made the radiology paper. And I'll show you a barium image also. Now in this barium image you can see there is an arrow at a structure, but you can see this is your stomach and arrow is at a cap shaped structure. This is your duodenal cap, which is the first part of duodenum. Then after that you can see a C-shaped area which is the duodenum, and after that you can see these feathery appearance which is due to volvulae conniventis, that is the jejunum. So the arrow was at the first part of duodenum, and there is a previous FMG question, you might not remember, but there is a previous FMG question in which they have asked duodenum first part looks like, the answer is cap. It looks like a cap, duodenal cap. We call it duodenal cap or duodenal bulb. So this is the first part of duodenum which is asked as an image based question. There was one or two more questions where I don't have a recall, but some people said there was a question in anatomy where they had marked on a cross section internal capsule, and some people had an idea that there was a question on aortic dissection to identify or to tell the management, but these are usually predicted questions and I don't have a recall image for them. But this was one of the things that there was probably an MRI or a CT scan where there was an arrow at the anterior limb of the internal capsule and you had to identify, and there was a question probably where there was aortic dissection shown on a CT angio, or you had to identify the two lumens. But all said and done, if you look at it, the number of radiology questions or questions which had radiology images were quite a lot, and I think most of them were doable, direct questions. And what I've understood from most of the students, that most of my students have been able to do almost each one of them. So I'm very proud of every one of my students' journey, and I want you to, be very optimistic about the results. I am here to wish all the best to all the foreign medical graduates who have appeared for this exam. Be confident, be positive, things will be in your favor. This was, the paper 1 was doable, paper 2 was tricky, but when we go deeper, it was not directly repeated, but you could do it. You could do it if you go deeper into it. And that is one of my advices for all the people who are appearing for the March NEET PG exam or the June FMG exam. And again, I want to emphasize that in June this year, in the middle of June, most likely you will have a FMG screening exam. Next, if it is implemented, will happen in December. So you have a mid-year FMG exam also to look at. So, many people have asked me this question. So for both these exams, it is important that if you are able to rule out two choices, please go for it. Please try to rule out choices. You may not know an answer directly, you may not know any answer directly, but if you look at the choices, you will be able to rule out and get to the answers. So the usual themes are, if I am an examiner or if you are the examiner and you want to make an undergraduate PG entrance paper for radiology, you will put one bone tumor ka X-ray, you will put one brain hemorrhage ka CT, you will put one or two radiological anatomy, one or two barium images, or like this. You can also actually predict the entire paper yourself. So this was the theme: emergencies, brain hemorrhage, foreign body, stone. Classic things have been asked in the radiology visuals, and I wish and I hope that you got every one of them right. My fingers are crossed for your results, and I wish you all the best. All my optimism, all my good wishes, all my prayers are with you for your results. I also want to use this opportunity to announce that we are starting a live batch for June FMG exam on the eMedicoz app. It live means it will be two-way interactive. You can chat with the teachers, ask your doubts, because you have to understand clearly to solve the questions better. It is not a pre-recorded app, because pre-recorded apps, to best of my understanding, are like collecting books. You can buy Harrison, but you still have to, somebody has to read it for you. So I believe in live teaching, and I'm also starting a live face-to-face batch in DAMS Gautam Nagar for the FMG June exam. So anybody who wants to attend a face-to-face class with a hybrid advantage of getting a app access also on eMedicoz for the entire curriculum, you will also get that advantage also. So both these courses are now starting, and I also want to tell you here that stay positive. Put all your optimism into it. Don't let the negativity in the world affect you. And I'll end today's discussion by telling you very important line. I shared it on my Instagram also today. This line means a lot to me कि हो सकता है सुराख आसमान में एक पत्थर तो तसल्ली से उछालो यारो. सब कुछ हो सकता है. Don't look at this FMG exam as a tough or impossible thing. You can do it. You can go even beyond it. I know of foreign medical graduates who are now pursuing, and actually who have finished their MDs in places like AIMS also. Everything is possible. Just एक पत्थर तो तसल्ली से उछालो यारो. I wish you all the best. God bless you.